Hello, my name is Terry Schultz. I'm a physical therapist. The purpose of this video today is to briefly review sciatica and, more importantly, to discuss recommendations for electrode placement for optimal pain relief. Sciatica is pain felt in the distribution of the sciatic nerve as it exits the low back and runs down the leg. The sciatic nerve is often pinched in the lumbosacral spine by a herniated or bulging disc. A secondary location of pain commonly experienced is in the buttock. This is a piriformis muscle. The sciatic nerve pierces through the piriformis and muscles below as it exits the spine and down the leg. This pinching here is also called piriformis syndrome. And men, if you're wearing large, bulky wallets in your pocket, you might be creating or worsening this pain. In my clinical experience, I've used electrical muscle stimulation, EMS, quite effectively to treat and reduce sciatic pain. In doing so, we're targeting the pain, first and foremost, and secondarily, we're targeting trigger points that often cause the pinching pain in the low back or in the buttock. I also recommend stretching following electrical muscle stimulation while the muscles are loose. And I definitely recommend physical therapy follow-up and treatment for strengthening. Let's talk about electrodes. I like to use the large electrodes because they're just large enough to cover a large surface area, but small enough to target trigger points that cause sciatica. Small, medium, or extra large electrodes just aren't quite as effective in my opinion. I also want to emphasize the skin needs to be clean and clear. And I definitely recommend use of Hydow's Perfect Conductor Spray. It gives a much better conductivity and pain relief. Now, Christy is going to be our model to demonstrate electrode placement. We're going to use the ProTouch Wireless 612 because it's free from wires and uses a battery pack that allows freedom of movement. First and foremost, I'm going to demonstrate placement of electrodes along the spine for pinching of pain in the low back. If you just feel along the top of the hip crest and follow right over, you'll feel the most common area for impingement. I'm going to place these electrodes right along the spine, just above, and below. Okay. Secondarily, I'm going to place electrodes, if the pain originates in the buttock, from piriformis syndrome or pinching pain that radiates down the leg, electrode placement can be placed just below the low back at an diagonal angle. Make sure the electrodes are not overlapping. And diagonally down and outward to make sure we cover those muscles. I'm placing these electrodes on our shirt here for privacy purposes, but the electrodes should be placed directly on the skin. A third option is to use electrodes both along the spine and the buttock, the piriformis muscle area, for optimal pain relief. This is what I often use and works very, very well for myself. I hope this tutorial has helped you to treat and reduce your sciatic pain.